Hello, everyone. I'm Dustin Nowoski, founder and president of OutCare Health. My pronouns are they, them. Thank you for joining us today for OutCare's OutTalk series, a webinar series devoted to discussing diversity and intersectionality within LGBTQ plus communities. We've had many people tuning in today, and we're very excited for you all to listen to what is probably going to be a wonderful conversation about LGBTQ plus care. We want this to be a safe, welcoming space as much as possible. So if you feel comfortable, please post any questions today as we're discussing topics. All Out Talks are recorded and they can be watched on our website after about 3 to 5 days after today. And I'm very excited about this Out Talk titled Pride in Healthcare, Meet the OutCare Team. Today, you're going to hear from inspiring people doing amazing work across the country. And I'm also very thankful for our moderator today and a very dear friend, John. John, take it away.
Hey, thank you so much. It's lovely to be here with you all today. And I'm actually really excited about this conversation as well, too. Um, I looked back and my first email with OutCare Health that got me involved in this was back in 2022 when I was a panelist on HIV and aging. And it was a really cool conversation. And I got really excited about all the work that OutCare Health was doing when I started connecting with the organization. So here it is 3+ years later, and I'm still on board. And now I get the honor of meeting all of these amazing people today who are part of the OutCare Health community. So the invitation is for each of them to introduce themselves, tell a little bit about their work with OutCare, but also a little bit about the rest of their work that they do in their lives. And they get a bonus question. And that question today is someone in your life so far who has been an inspiration for you. So, with that said, guess what, Jem? I'm turning to you first. So, take it away.
Thank you, John. Thank you, Dustin. I am I just love OutCare. Let me just start by saying that. I love being in this space, and I'm so thankful that I get the opportunity to sit on this panel today and just to talk a little bit more about OutCare. So yeah, my name is Jem, pronouns they, them. I am currently a New York transplant living in North Carolina. Right now, I think we said what we're doing outside of stuff or
Who you are as a fully realized person.
Okay. Yeah. So I'm really thankful to be able to work in gender affirming care. I've been doing that for the last 5 to 6 years. I also work in my own spaces with folks who are using substances. I'm a huge harm reduction advocate. So that's where most of my time is spent. Um, and within OutCare, just kind of doing a lot of different things, kind of supporting in any way that I can from North Carolina's angle. I've had the opportunity to represent OutCare throughout the prides here, and then also most recently started working with the OutList and introducing that to providers here in North Carolina, which I will probably talk a lot about because I think the OutList is one of the most important things within this space. So that is a little bit about me. Somebody who's inspired me is my mother. She is a Haitian immigrant who came here many, many years ago and just built this incredible life for her family. So shout out to my mom. She is the fiercest little Leo, and I adore her.
Lovely. And Jillian, since I haven't heard from you yet, let's bring you into the fold.
Absolutely. So, Jill Miranda, I've spent my career in digital health, and I was at a conference, I believe, when I first met Dustin and saw OutCare. It was one of the first years that this particular healthcare conference started to really spotlight LGBTQ health, and I was shocked in the best possible way. We expect so little out of our healthcare system so often, so it was wonderful to see Dustin and the incredible team doing such great work, and I've been hooked on being supportive ever since. And so I was super, super honored to join the board last year. And so I'm the board treasurer. I'm trying to ensure that our organization is able to do the incredible work that it has done for years, for many more years to come. Someone that inspired me, at least today, is Rima Hassan, who's one of the incredibly brave humans in EU Parliament. She's an EU Parliament member that were illegally detained by Israel in aid, trying to give aid to starving and dying children. She's currently in prison. Nobody's heard from her, and she's holding strong as all of the flotilla protesters were. So yeah, that's who inspired me today.
And Dustin.
Thank you, John. I just want to preface it's so lovely to hear from all of you and just be reminded of when we first met. It feels much longer than that, which I think is the beauty of friendship and family, that when you really connect with someone and really link with them, it feels like a lifetime very quickly. So I appreciate all three of you joining me today, and just all the love and motivation and just lived experience that you've provided the organization. While I am the founder of the organization, by no means our vision and the work that we're doing today is entirely me. If anything, I'm a very small fraction at this point of how the organization is growing. And so I do appreciate all of you and what you've done for the organization. But for those of you I don't know, I'm Dustin. My pronouns are they, them. I'm the founder and president of OutCare. I started the organization back in 2015 when I was a medical student for a variety of reasons. I was struck by the lack of education that I was receiving. And at the time, I was trying to find a provider that could fit my needs. And I felt very uncomfortable in a very fragmented system, which is healthcare. And I kind of pulled all these things together. And at the time, it was a lot of frustration, which really turned into passion, which was how OutCare was born, actually. Um, but outside of OutCare, which keeps me very busy, I'm a psychiatrist here in Los Angeles. I identify as queer, non-binary, and I bring my identities to every single session that I have. I work at a university here in LA, and then I also have a private practice where I see Californians and also people from Indiana, which is where I'm originally from. I get inspired by a lot of people. Having the privilege to run a national organization, I meet a lot of people with privilege, but more so people with marginalization and a lot of disparity. And I'm very fortunate to have met these people that are striving every single day and doing tremendous amounts of work for their own health and their communities at large. And so I'm inspired by the OutCare network. But someone that specifically comes to mind, I met a patient a couple of years ago when I was working in a gender affirming clinic in Indiana, and they were in their late 70s. They were about to turn 80, and I was the first provider that they came out to as trans. And it was just hearing their story filled me with a lot of excitement, but also a lot of concern for the current system and where it was trajectorying. And I felt for this person so much, and I worked with them for years. They obtained hormones. They even had gender affirming surgery at their age, and the surgeons did not want to perform it, but they did. And after all of that affirmation, I really was the first person that got to see who they truly were, that they weren't allowed to be for almost 80 years of their entire life. And so for me, I go to bed and I think about that person often because it was really a good example of what I wanted OutCare to be and how I could help people. And I think about them often, and they're doing quite well. I check in with them from time to time. So inspired by a lot of people, but that person comes to my mind often.
Oh, that's beautiful. Thank you. And once again, I'm John Sovak. I'm your moderator here today. And I came to OutCare Health first as a provider, and then got pulled in the family as an expert on a couple of different topics, and then came into the family to do this part of the organization, which has really been amazing work. I'm a therapist here in Pasadena, California, and I specialize in working with LGBTQ adolescents and their families during the coming out process. And I am the author of Out, a parent's guide to supporting your LGBTQIA plus kid through coming out and beyond. And there's an exclamation point on that title, so it makes it even more fun. And for me, I see inspiration like every single day in people that I meet. And today I got inspired by the cashier when I was buying lunch, because they asked me the ubiquitous, "How are you doing?" I said, "I'm okay." And they said, no, really, how are you doing? And we ended up having a full-on conversation, and they were really straightforward with their difficulties right now and all of the energies that are, buzzing around Los Angeles. And it was this really cool moment of someone risking being seen and allowing me to be seen. And I found that incredibly inspiring just today at lunchtime. So I'm kind of like Dustin. I see opportunities to be inspired on almost every step of my journey during the day. So kind of jumping in a little bit into, the conversation today is like, so what brought you all to OutCare? What was intriguing about what OutCare was specifically offering that you said, I want to be part of this organization? And how did that journey begin for you? So, Jill, I'm going to actually have you bring us into this.
What OutCare means for me in the healthcare context.
Yeah, and how you were attracted to it and what brought you here.
Yeah. Again, I think what attracted me was seeing a solution in a really fragmented ecosystem, right? At that point, I was working with a lot of different digital health companies, and there were very, very few LGBTQ health companies, and even fewer businesses that were even focusing on it at all, right? And this was during the time where we had a million mental health and behavioral health resources and apps and companies and founders, and we were focusing so much on that support and your average person needing it, and yet there was very little focus on those who are marginalized, right? And taking that marginalization into account in their care and actually creating and having any type of culturally competent care. And so it was really felt. I mean, Dustin, like you're saying with patients, right? Like you see it happening. It happened, like you have your experience as a patient and then you watch other people suffer. And so when you see people that are working on the problem, not only personally does it feel like a win, but it feels like the world is kind of opening up. Gives you a little bit of hope, renewed hope in a system that's very, very broken. So I think that's what OutCare meant to me and continues to mean to me.
Yeah, that's super awesome, Jill. I am trying to think back of like when I first got introduced to OutCare, and I really, it feels like I've literally been a part of this for so long. And I remember talking with Dustin, and just realizing like, there's in the medical space, like it's really difficult when you are clinical staff to really bond with folks who, have these titles and these accolades and things. And I remember talking to Dustin and exactly what Dustin said about remembering that patient and like just keeping that is what really made me want to dive in more. I feel like when I first started like investing in OutCare, every week I was like emailing because I was like, listen, I want to do something. Like I want to be a part of this because it's really interesting to watch a provider truly want to not only support, the folks out here, but also support the folks that are doing the work outside of that. And I remember thinking like, this is going to really change the way that folks are operating in healthcare. From my perspective, one of the most amazing things is Dustin calling out other healthcare providers. And I think that it's so cool and it's so amazing. And I hate that term where people are like, oh, we're like a family here. Cause that's kind of scary, right? Like in this generation, whenever I hear that, I'm like, you know what? Absolutely not. But when Dustin said it, I was like, you know what? Like, yeah, we kind of are. And that family part was just having Dustin advocate for other providers to say, listen, you may say that you're gender affirming or that, you really care about, diversity and inclusion, but here are the reasons why, you're kind of missing the mark. And that was inspiring to me. And ever since then, I was like, I got to be involved with OutCare for the rest of my life.
I'd like to quickly add to that. From a patient perspective, right? Especially as someone who started getting mental health care fairly young, you feel kind of helpless, right? Like the provider has all of the power in that relationship. They can give you medication or not. They get to make the decisions. And often it feels like you're just a passive participant and you're just hoping and praying that they listen and that you get some say in it. And so seeing providers say no, fuck that. We are going to give agency back to our patients. We're going to advocate for them, even when they can't advocate for themselves, and kind of shifting that power dynamic to really include the individual and the patient in that care is so freeing and so revolutionary for so many people that have never gotten to have that experience. And so I love how Dustin took his own clinical experience and said, you know what, this isn't just about me, this is about everybody. And I'm not just going to criticize, I'm going to create a solution. Because there are a lot of people that are critiquing it, but very, very few who have created any resources or solutions to the problem. And that's what was so exciting and continues to be so exciting about OutCare.
Yeah, thank you all for both your words. I mean, that's Yeah, I'm reflecting on, how I felt a decade ago because we just celebrated, as you all know, we celebrated our 10th birthday last month, and yeah, I mean, it's, I think it's a little bit of a lot of things, actually. It's not my personality, to have a power differential. I remember when I joined medical school, I was like, what is this? Like, I did not grow up with medicine or healthcare. It felt like very hierarchical. There were like a lot of steps, right? And there were a lot of people that had, I called them double doctor families because their parents were doctors and then they were born and bred to be doctors. And that was not my life. And when I was learning about how to like talk to people and treat people, it felt very like an imbalance of power, and it was very authoritarian. And I never felt comfortable with it. But at the time, I was going to doctors, and I had been out for quite some time, but I didn't voice and talk about my outness with people other than my friends. And so it was one of the first times where I talked to a stranger who was supposed to be in professional settings and really advocate for me, right? I'm there for my body and for my health. And time and time again, it was over and over and over. I was getting the same negative experiences, some like blatant discrimination, and then other times were just misguided conversations where, I can't tell you how many times the first thing a primary care doctor asked me was like, when's the last time you got an HIV test? And that literally was the first thing they asked me. And so, I think I had to go through this cycle over and over and say, like, if I am experiencing this and I'm about to be a physician, I can imagine people who are not physicians, people who are not in healthcare, people who don't have any type of healthcare knowledge or education. They're not going to advocate for themselves. And so my experience is multiplied by millions across this country and this world. How can I use my own privilege as a platform to really rectify all of these very substantial historical gaps in care? And, we're nowhere near where we need to be, but I feel like we are closing that gap a little bit over time.
And in the mission for OutCare Health, the very first sentence says OutCare Health is dedicated to promoting health equity for LGBTQ communities. And I would be curious from each of you who is part of OutCare Health, what does that mean for you in your work with OutCare Health, but also in the current climate that we're in about promoting this health equity for LGBTQ communities?
I'm happy to take that one first. I do a lot of work in women's health, right? And so health equity is, and I also do a lot of work with businesses that are trying to innovate in the Medicaid space, right? So health equity is a dirty word now. You can't say it. I know founders that have had to stop fundraising because this cultural moment, nobody will get near it, right? People are trying to find other ways to say the same thing and say accessibility instead of equity, and trying to find go-arounds around this very basic principle of treating other humans like humans, right? And it has become politicized, and it is in a way that's it breaks your heart to see every day, right? And there are very few organizations that are holding firm and saying, we're not changing. We do stand for health equity. It does still matter, and we're going to take the fight head on. And so when you experience an organization that isn't shying away, that is bold, and really leading, because very few businesses are doing that right now, it's really, really meaningful.
Yeah, I just want to echo that too. And I think for me, that's kind of the same thing, right? Is like, I'm grateful to be a part of a lot of different spaces when it comes to using that word and when it comes to looking at inclusion. But I'm especially grateful to be a part of an organization who is not trying to take away from what we're supposed to be doing as folks in this space. We're not going on Chat GPT and making up words and figuring out how do we say this but not say this. Like Jill said, like we're standing firm in what the goal and what the mission is, for this organization. Because I think people get caught up in hearing all these letters and all these terms. And I think we're really not understanding, like, there are human beings here that deserve care, that deserve love, that deserve space to be held for them. And this organization is saying, like, this is what we're going to do. Right now, it is really being in all these different spaces, like public health spaces, clinical spaces. It's really interesting to watch folks try to figure out the puzzle pieces of we should say this, but we shouldn't say this. And I think one of the most amazing things is we had a meeting where we just kind of talked about what we were doing as a board and what we were doing within this space. And there was no trying to figure out how do we get around here and get around this. We just straight up said, this is what we're doing. And that was really inspiring. So I think, like Jill said, it's really, it's a hard space to navigate, but we're standing firm here.
Yeah, I want to echo that too. Standing firm is critical right now more than ever. And, I think for myself, as I mentioned earlier, I bring my identity every single second of my life with me because that's important. It's important for me, but I also think it's important for what I represent, whether it's OutCare or my position as a physician or working in a system or just being a human going within communities and walking down the street, right? I think it matters. And while I do have a privilege of safety, especially given that I live in California, to be able to do that, I do recognize that that's not safe for everyone. Because I have those privileges, I will do that. I will do that for myself, and I will do it for everyone that I can. But it's interesting having done this for 10 years and being out prior to that and feeling very comfortable in my skin, but then seeing socio-political changes and systematic changes make me feel like I'm going back in the closet. I have felt pushed more than ever than I have in my 34 years of living. I felt more push in the last 3 months, especially this year, than I ever have in my entire life. And I'm very vocal, I'm very out and open, and I'm second guessing a lot of things that I'm doing, and I'm getting terrified. And I'm reminding myself that, those are unfortunate, normal feelings that marginalized people have to face now, especially their safety. And so I'm going to keep pushing harder than I ever have. But, I know that there's this dialogue, right, of like things changing, and sure, some systems are doing the same thing and they're changing their language. But, my perspective on this is it's a word, and words and communication and language matter. They matter because they have meaning. And you may use a synonym, but it's not the same word. And if you double back on your language, you never really had the value in the first place. And I will stand by that. And so whether you want to switch out equity with culture or switch out equity with community, and even if you're doing the same thing, you're double backing, you're retreating on the value that you said you had. And therefore I question if you had it in the first place.
Mm-hmm. Yeah. And that's why we're the organization we are. And it attracts the people who support those ideals. And that's why I think that mission statement is so powerful the way it's written. For those of us who are joining us live, there is room if you have any questions for the panel. Just go into the Q&A. You can type them in there, and we're more than happy to take a look at them. But one of the big things that's also in the mission statement is this whole idea about education and training being one of the major initiatives. And just a show of hands of this panelist here, who's been involved in any of the trainings or any of the education work? Show hands up, anybody? Yes. Okay. Okay. So let's talk a little bit more. Like, what do those programs look like? What parts have you been involved in? And how do you see them having an effect on helping providers become more educated in the work that they're doing with our community?
Yeah, I can jump in, just given that, I'm one of the founders, and so I want to make sure that I set the platform and allow Jill and Jim to provide their experience. So the reason, well, I mean, there's a lot of reasons, but one of the calls to action that we received early on when I started OutCare, we started with the directory, which is what we're most known for, having the largest directory in the world of affirming providers. And people were joining once we started. They continue to join every single day across the world, and that's been wonderful and just an amazing journey to see. At the same time, in the beginning, a lot of those providers were those word of mouth providers, right? They were the names on the research publications. They were a part of the big institutions across the country. And we weren't really identifying those providers who were affirming or who had some education or level of training. And we wanted to make sure that we were exemplifying them as well. We also then were getting a lot of feedback of like, this is a very small fraction of the entire workforce. So what about the 95% of providers who might actually be very good affirming providers? They just don't have the training, they don't have the foundation. So that's really where our education and training started. It was really to fill in that gap, to make sure that we're not elevating just the affirming providers or the people that care. We're elevating everyone, because this is a standard of care that should be universal. And so in the beginning, I remember I was doing countless trainings over and over and over. And, I started to transparently, it became a little monotonous to me at certain points because it felt like a record, I was repeating myself over and over. And I realized that I needed to really check my own biases. At the time I was a resident, I know a lot about mental health and psychiatry. And the older I'm getting in healthcare, the less and less I know about everything else. And so I started to really think through, like, if we give education and training, it's not just me. It's not just a couple providers that I know. It needs to be the entire OutCare network and family, because I want as much lived experience, as much perspective, as much people who are doing this day to day to actually deliver the training. And I will say, I attend LGBTQ plus one-on-ones all the time. The thing that irks me the most is whenever a white, cis, heterosexual man is delivering an LGBTQ plus training and they know no point of reference. They talk about queerness as if they know exactly what they're talking about. I'm like, you have no idea. You're kind of like, you're all over the place with this concept. And so for OutCare, one of my core missions is that whenever we deliver training, it's going to be from the people who have those identities, who have the experience, who live this day in and day out, who really know what they're speaking on, so that they can make this a robust experience as much as possible. And so with that, I know that, Jim has been doing tremendous amounts of work with us, especially on a California mandate. So Jim, I'd love for you to kind of give some perspective on that.
Yeah, thank you. So, my personal experience, this has just been really amazing to see, because I've kind of had like the opposite, the thoughts, in the sense of, I work with a lot of providers who are gender affirming, and I feel like those providers are the ones that lack the knowledge completely. Not only working with gender affirming, patients, but also working with folks within the spaces, who are, queer and who are Black and brown. So it was really interesting when we started working on this together. I was just noticing how, like, wow, I'm really taking some of this information and some of this training, and really sharing it, within that space that we just worked on together. It's been really surprising to me how the trainings are so outdated, and you get this person up there who, like Dustin said, I mean, to be honest with you, I was giving nonsense, because I was like, you're standing up here and you're talking about nothing. And again, it's these chat GPT, manuals that folks are putting together, not taking into consideration that they're working with real life patients and real life people. So from my perspective, like, kind of working on that too, I was really excited that I had folks who wanted to use this training and say, listen, like, we want to look at this, for folks coming into these spaces, coming into gender affirming care spaces. So I had an amazing time. I learned so much working on the training with Dustin. And I'm going to be honest with you, at some point I was like crying, because I was like, this should just be across the board. And it seems like it was so much work, and it took a lot, I know, out of me to kind of really realize, like, we are so far behind in some of these healthcare spaces. So I'm really thankful that I was able to work on that with Dustin.
Jillian, anything you want to bring in?
Yeah, for us, by us, right? Like, it's necessary for I mean, like, the amount of times that you see a dude running a women's health company, right?
Yeah.
Like,
Mm.
we see it all the time in our industry, unfortunately. And I think that it goes for clinician, it goes for everything, right? Like, the lived experience is so critical. And it's so lacking. And you, as the patient on the other side, right? Like, we can tell when someone is not in the community talking about the community. There's a huge difference. And not that we can't have allies that don't want to help. Like, we want to bring others in, of course, but there needs to be that understanding that when you're educating others, you need that lived experience yourself. And it's so infrequent that is actually done, which is mind-boggling. But it's the unfortunate reality.
Mhm. Yeah, and we talk about, I do want to make a clarification, because I have presented modules education about this very thing, about, in the past, we, even OutCare, we would use terms like cultural competency, and we shifted away from that because of the context and the semantics, right? And it has a negative connotation. And so we use affirming care, right? To, like, talk about this dynamic experience of affirming people for who they are. But I've delivered modules that talk about lived experience. And for transparency, I've had many cis heterosexual providers get angry at me because they think what I'm saying is that if you are cis and straight, then you can't be an affirming provider. I've never said that, and I don't believe that. Lived experience is a very broad topic. It does not mean identity, and that's not what we are saying. We are saying lived experience in some capacity, whether it is your identity and you actually have endured stigma, discrimination, marginalization, or are you nested in the community? Are you going to the Pride festivals? Are you volunteering? Are you doing as much as you can to really understand what people are going through when we do talk about things like LGBTQ plus discrimination? It doesn't necessarily mean that you have to have experienced it yourself. Now, obviously, that is a level of connection that a lot of patients want to feel when they're interacting with their providers. But whenever we're talking about what is a better workforce, an affirming workforce, lived experience is a much broader topic than I think a lot of people realize.
Mhm. You know, and one of the things that I remember identifying very quickly in my program for being a therapist in grad school was there was almost no conversation about the needs of the LGBTQ community. There was like maybe a little in passing 1.5 hour, hey, there are gay people out there. Hey, there are queer people out there. And that was about the extent of it. And of course, me being me, I went to the director of the program and like talked about them. They happened to be an out lesbian in the system. And they were like, that's just the way the school does it. And that was not an acceptable answer for me. And so that's what really lit a fire into me to really get out there and start doing training everywhere that anyone would allow me to stand up in front of a group with or without a microphone. I don't need my PowerPoint slides. I just want to talk with you, to try and let people know the reality of our needs in all levels of healthcare, and especially for me in particular in mental health care. And so I think, you know, identifying that that is a big part of almost every program that's doing training out there is that we're invisible. We're mostly non-existent. And so it is definitely still a big uphill battle. You know, and I think that's a thing that I would want to look at too, like, especially with the current environment, like what do you see as the challenges that OutCare Health is facing currently, maybe some ones they faced in the past that they've overcome? Like where do we see the roadblocks that are starting to pop up now in this really important work that we're all doing?
Yeah, it's a great question, Don. I mean, I have a couple of perspectives on this. I think first and foremost, we are seeing a lot of conscious retraction from our partners, and it's very upsetting for me to say this. I've had a lot of feelings about this over the past 6 months, but historically, we're a growing organization. We have had beautiful partnerships over the last decade. A lot of those partnerships have stayed with us, and they've stayed with us because we've shared the same values and missions and goals, and we've done amazing programming, and it's helped support hundreds, if not thousands and thousands of people across the years. And it is disheartening to even think about this and say this out loud, because a lot of these organizations, I have created such a relationship with them that I do feel internally that they are friends, they are family, they're chosen family. And I have felt that way about a lot of them for years. And unfortunately, these past couple months, we've done some outreach, we've done some Pride campaigning and fundraising. I've asked them, would you like to be a Pride sponsor? Would you like to support the mission? And it doesn't have to be monetarily, right? It could just be just activating our organizations together. We've seen a 95% reduction in donations and sponsorships, and even just programming. I was looking at our numbers, and it's 95% donations total, but it's also 95% of partnerships have retracted. And it's because of the current socio-political climate that it's permissible to do so. It's permissible to just say, this isn't a value to us anymore. We don't have to externalize this because our current government doesn't see it as important, or that it's just a buzzword at the end of the day. And these are people and groups that I found were affirming, people that I trusted, and they won't even, most of them haven't even responded to multiple emails. It's not just we can't do this right now for X, Y, and Z reasons. It's actually making us invisible again. And it's really, I've felt this way. I've seen this from many people in my life. There will be malignant people always in the world, unfortunately, but it is extremely upsetting and shocking to see that there are people in the world in groups that will support communities in a very performative way and back out the second they have the chance to do so. And it is terrifying. And that is currently what this organization is experiencing, like many organizations across the country.
Yeah, a few thoughts here. First of all, history is not linear. We like to think of it like that way, right? It's a lot easier to think that we're just making progress. It's regressive. And so we're in like a major regression. And this has happened before, right? Like this, we saw this like in 2020 with BLM. We're seeing it now with on every different front, it feels. In times of trouble and tribulation, you really figure out who your real friends are, right? Like who are the ones that cared to begin with. But more than that, I feel like for me it's twofold, right? Because there's the folks that they were never mission aligned to begin with. This was performative, and they're almost relieved that they don't have to pretend anymore. And in healthcare and looking at like businesses, I think there was so much of that. And we were expecting it. We all knew that it was performative. We were aware while it was happening, right? And then there's also this other group where it wasn't performative. They did care and they're afraid. And there's just so much fear, right? And I feel this particularly like with certain providers as well, right? Like, depending on what state you're in, you're getting criminalized yourself. So, there's, of course, the people that were never mission aligned, but now we're also seeing the people that are still mission aligned, but they're terrified, right? And the only way they know to keep themselves safe is to be silent. And that to me, like, is more heartbreaking because that's something that we haven't seen en masse like this in a while. There's always been criminalization of LGBTQ people, but the criminalization of care, of language, right? Like it's just gotten so much worse. And I look at the people who I know really do care, really are allies, stepping back, and you're angry because how dare you step back when the rest of us are standing firm? But you also have to remember the human empathy of like this is what happens. This is what happens in fascism, right? Like this is what happens when like the order of the day is just mass fear.
Yeah, just hearing Dustin speak, like I don't know what's going on with me this week. I think it's the strawberry moon. I'm very emotional. And just hearing Dustin speak, and for me, one of the main things is like this lack of collaboration. And I feel like there is something, to me, it's very simple, right? It's just like everything is performative. And folks will get creative with a milkshake at Steak and Shake. They'll get creative with a burger at Burger King, but they will not get creative about the care and about loving other humans and simply just being there for folks. Like every year we watch the pride flags go up at Target and Walmart and all these ridiculous, things. And then that's where it ends. And I think it really goes to show like the heart of where this organization is to continue to reach out, to continue to, put that in folks' ears, like, hey, we do need to collaborate in this sense. I'm coming from a very large clinical space here in North Carolina, and I think it's really amazing sometimes, and I say that in a sarcastic way, to watch these really large organizations just not care. But then they'll, in their spaces, they'll put up a pride flag and they'll say, like, we love people here. And then you have organizations like OutCare Health that, out to me personally, just from the last couple of years of being in this space, when we did the mentorship program, I have had the honor of like hanging out and being a peer to 7 different people, 7 different young queer folks. And just that in itself, you would think would inspire folks to say, let's collaborate here. Let's really lean into this space. So it's not just, this is not performative, and the emotions that we're talking about and how we feel is very important. And I think that they're, like Dustin said, using privilege, in a way that is helpful. And unfortunately, we're not seeing that. Like, we're just seeing folks be scared. And as a person of color, as a queer person of color, sometimes it's very hurtful to hear, folks say, well, that it is what it is. Because if this was a couple years ago, my life would be at risk with it is what it is. So it's really hard. But again, like being a part of an organization that is, so diverse and so hell bent on providing care and standing firm is really important. But those emotions are real, and the lack of collaboration is real.
Yeah. It's, and it's shocking too. I mean, I'm not super vocal about this because I don't want to instill fear in people because healthcare is very complex, and I I never envisioned that I would be an opportunity in my life to jump out of a provider role and jump into like a system role. And I can tell you that I have met with every major healthcare insurance company in this country, and I have had CEOs directly tell me on calls that LGBTQ plus isn't a priority, or that there's no return on investment, or all of these very like just negatively worded, monetized conversations about people and their lives. And I will respond and say, I just want to clarify. So you're saying that my life as a queer person is a priority for you? And there have been times where they have literally told me yes. And that is reality for us, for LGBTQ people, as marginalized people, especially LGBTQ people of color. The higher up you go, unfortunately, the less care and recognition that you'll get. And that is unfortunately a function of healthcare systems right now. Hopefully, with OutCare and what we're doing, we can get into the system and dismantle that and actually rectify it and provide that lived experience for people to actually say we all matter. But we are nowhere near there. And it's I think the reflection that we're seeing actually has always been there. The systems now just have the opportunity then to externalize it.
And I want to thank all of you for recognizing the emotional side of these roadblocks and obstacles we're facing right now. In the chat, there's a lot of people who are also recognizing there's fear in their communities. And I think by being able to speak it out loud, it makes it a less isolating thing. I'm not just feeling it in my home or my community, but oh, here are other people feeling it as well too. So I want to thank all of you for identifying that and the emotion-based part of this as well. I think that's really, really important because we're all having big feels right now, you know, and being able to hear leaders in the field identify this well, I think is very powerful. But I want to turn our conversation a little bit away from obstacles for a moment. And I actually want to take us back to the work that OutCare Health has done in communities, because that's actually been the strength that I've witnessed in OutCare Health is being able to access all kinds of different communities and bring programs and care, and sometimes just bringing a listening ear to those communities, or a platform like coming here on the OutCare Talks and being able to speak openly about stuff. So how have you all witnessed the community effect, the community influence that OutCare Health has had out in the big wide world?
So I want to jump on this real quick. The directory, I know Dustin had mentioned this. So whenever I go to Pride, that's my thing. Like, I just make sure I have this ready to pass out to folks. And I'm going to be honest, like, as somebody who is in clinical care, I use the directory almost every single day. And I remember talking to someone who was 22 or 23, and they were looking for a provider that, was affirming. And I was like, listen, I got this for you. And the look on their face, and they were like, oh, this is like directed towards like LGBTQ folks. I mean, we had this moment. And if you know me in real life, I love to cry with people. I love to hug them on the street. I'm hugging this person over the directory with OutCare. And it was just such a beautiful moment. And then that person went and told this person. And then I remember being somewhere out here in Durham, and I saw one of our little cards like in this shop. And I was like brought to tears because I was like, this is what this is all about, is like this community and folks knowing that this is a safe place. And folks who are not even LGBTQ identifying, they were like, you know what, I want to try to find a provider here because I want to feel safe. And that spoke a lot to what community looks like when it comes to OutCare.
I think community is the only hope we have, right? The solidarity that comes not just from people in the community, but from the allies, from the people that they don't live this experience and they still give a shit and they still show up, right? Um, Us coming together, that's the only way to stop or curb what's happening, right? I was at a panel a few days ago for Equal Research Day, and one of the panelists, who's a health policy in DC, she was talking about the fact that, hey, if you're silent, you're invisible. You have to call your congressman. You have to do all these things. You have to use your voice. And when we use our voices all together, we've seen that we can actually get power structures to retreat, right? This happened when the federal government took down a page on maternal health. And people were so outraged. Everybody got on social media. They sent a mass amount of emails. And literally within hours, HSS was like, oh, we're going to bring it back. Don't worry. It's not forever. And so it's fleeting, but you see these moments of success when we're all able to come together. And that's why organizations like OutCare that give us a place to convene, that give us a place to go, to be together is so important because it's we fail as individuals, right? It's only together that we can actually hope to change things.
Yeah, yeah, I agree. Yeah, I mean, thank you, Jill, for those words, because the thing that I hope people take away most when they think about OutCare is family and is community. I'm from the Midwest, and I do think, despite like growing up in a red state, I do think that I was humbled by growing up, and people call it hospitality in the Midwest and the South, and it is very real, whether it has a lens of conservatism or not. I mean, it's a very humble place, and it's, in some ways a good place to raise a family with families and values, if you are affirming and you want to do the right thing in the world. And so I feel very privileged to have those values, and I try to bring that into the org and let it feel that way for people, because I don't want people to feel isolated. I felt isolated most of my life, if not until recently. And I still to this day, I have societal isolation because I know that the world isn't safe for someone like me. And so um, community is so critical for me. And I think what has happened with how long we've been around and what we've inspired people to do has just been so inspiring to me, where we've trained young adults, whether they're medical students or people in the healthcare professions, and they feel empowered, right? They feel empowered to do something in their local communities. And as Jim said, to like share the resource and say, like, this resource exists and you can tap into it, and then you can learn something, you can get great care. And it's just been so beautiful to see that growth and to educate people and let them feel inspired to make their own change in their own lives and feel meaningful and accepted and validated. I never envisioned that that's what would happen with this organization, and I'm so thankful that it has. We've had so many people find a provider for the first time in 20, 30, even 40 years of their life, and they've donated to the organization. Or we've had people do like fundraisers on their own and just be like, I did this because, I found a provider and I love them and they're a great provider for me. And it's just so wonderful to hear those beautiful stories, because if we didn't exist, they may have never had those opportunities to feel better and more comfortable in their skin. And so for me, that's very meaningful, and how this organization shows up in the community.
Yeah. Yeah. So we're getting close to time. And in every one of these talks, we like to finish with this one shared question. And it really is like, what is your hope or vision for the future? It could be the hope or vision of the future for OutCare Health, for the movement in our community. What is your hope or vision for the future in this work?
I currently have a lot of hope in the younger generation. And I know that we often roll our eyes at the kids that are always on their phones and the alphas and the Gen Zers of the world. Um, but I see so much hope in that. I have younger siblings, and just those 5-ish years of age gap, 5, 10 years of age gap, you see such a change, right? Like it's just assumed that you would ask someone's pronoun. It's assumed that like this, you would be tolerant. And it's not everywhere. It definitely does vary by state and areas of, and like your own individual like identity and privilege and so many other factors. But I do genuinely see an extremely like inherently different way of viewing the world and of viewing your relation to others, right? Like your place in the world and how you relate to those around you. I see a greater ability to say, no, that's wrong than I think exists in any generation to date, right? And that gives me a lot of hope.
Yeah,
Beautiful. Thank you.
yeah, I appreciate that, Jill. I mean, I'm again, I'm getting emotional, right? Because I have a queer child who just came out to me a little while ago, and I remember them saying like, I looked up the work that you do, and I saw the stuff that you were doing with OutCare, and I was like crying because I'm like, what do you mean you're looking me up, right? And I'm like, and I'm like thinking to myself like, I was so discouraged with everything that was going on. And then I remember like hearing my kids say this, and I was like, this is why, this is the why. Because not only do I get to share this experience with my child, but then also being able to connect, with folks who are 18, 24, who are coming out and who are trying to find their spaces in the world. I thought millennials were tough. These kids are built differently. They are built for tough. Because I'm like, they're not afraid to say no. They're not afraid to say that is wrong. And it's really, to me, that's where the future is that knowing that all the folks that I get to work with, as a peer support specialist, they are so interested in this organization. They're so interested in what we're doing here. And that definitely gives me, it gives me hope for the future.
Yeah. Thank you both. Yeah, I couldn't agree more. I mean, as Jill said, I think we all have a lot of hopes because we see a lot of things that need corrected, right, or at least more affirmed. Is the language I've been using more recently. But yeah, I think for me, one of my hopes is one of the pieces of language that we use for OutCare, which is that there one day will be a world where every LGBTQ plus person has access to quality healthcare and they feel empowered to live their healthiest, most authentic life. And I think with that authenticity, the ability for LGBTQ plus people to leave their homes, to walk down the street, to go to work, to go to restaurants, to go to health care visits and see providers and interact with strangers, that we no longer have background noise. We no longer have internal dialogue that we aren't safe, that the world doesn't love us, that all of that can be shut off because we are integrated in society as people. It is a very lofty goal that I've had with OutCare, and I say this facetiously, but my hope one day is that OutCare doesn't have to exist because LGBTQ plus people get to exist in the ways they want to exist. And right now we are very, very far away from that idea, and that what in many regards feels like a dream, but I hope that that becomes reality. So yeah, I have a lot of hopes. I've seen that on a micro scale with this organization, and I hope that we continue to grow and so that we can reach as many communities that are in need as much as we can.
And normally in this part of the conversation, I actually don't participate, but since I'm part of OutCare Health, I'm going to participate in this moment.
Mm-hmm.
So one of the things that I have always absolutely been stunned by and love about OutCare Health is the incredible variety of people who are involved in this organization, from interns who are in undergraduate school to people who have led the community into their 60s and 70s. And I've had the honor of speaking to so many of them in this particular environment here. And my hope or vision for the future is actually that OutCare Health will continue to grow and expand and always create this space where all voices have the ability to participate in keeping our entire community safe and strong. Because I think that's pretty fucking amazing. Oop. Well, now we'll have to take that out of the.
Pretty sure I did it earlier. So
we have a full team, John. They can edit whatever.
Perfect. But no, I do think it is one of the amazing strengths about this organization is the amazing range of people that are involved in this from all communities and all walks of life. And my hope or vision is that continues to grow and expand. And those who are listening to us today, maybe for the first time, that you say, you know what? If these people right here, these 4 people can do it, I want to try doing it too. And I want to speak up a little bit louder. And I refuse to be made invisible. And I refuse to be defined by someone else's version of what LGBTQ is. So with that said, I am bringing us to a close for today. It's been so beautiful sharing this space with all of you and all of you who have joined us and put energy into the chat. That's been wonderful too. I want to invite you all to join us on July 17th when our next talk is about gray matters, health, equity, and dignity for LGBTQ plus elders. Once again, another marginalized community that, really putting a lens on the care and needs that exist as we age in the LGBTQ world. So once again, thank you all for joining us. As mentioned earlier, this will be available for replay probably by next week, and share it with friends, family, colleagues, so the whole world can hear about this beautiful organization. Thank you all. Have a beautiful rest of your day.